Hi, my name is Leo, and I'm going to be going through this infographic that highlights various components of electroconvulsive therapy, also known as ECT. So, what is electroconvulsive therapy and why is it used? ECT is a psychiatric treatment in which controlled electrical currents are applied to the brain to induce a brief seizure. This procedure is performed under general anesthesia and is carefully monitored to typically last around 20 to 50 seconds. ECT is now been refined significantly over the decades and is now considered a safe and effective treatment in certain mental health issues. ECT is primarily used to treat severe and treatment-resistant mental health conditions. It is often considered when other treatments, such as medication or psychotherapy, have failed or haven't seen much progress. In some possible conditions that may warrant this treatment would be major depressive disorder, especially in severe depression, and bipolar disorder for acute episodes of severe mania or depression. ECT was introduced in the 1930s as an alternative to crude treatments like insulin chemotherapy. It emerged during a time when the biological basis of mental health illness was gaining a steady traction, but pharmacological treatments were still in the beginning phases. Initially, ECT was applied indiscriminately, often without proper patient consent or understanding. Ugo Carletti and Lucio Benini, Italian neurologists, developed electroconvulsive therapy in 1938 based on their hypothesis that controlled seizures could have a therapeutic effect on psychiatric patients. Meanwhile, Ladislas Medulla had earlier experimented with chemically induced seizures, laying the groundwork for concepts of seizure therapy as a psychiatric intervention. It wasn't until the 1950s that ECT gained popularity in institutional settings, as it offered a quick and visible method to manage symptoms in severely ill patients. However, the lack of anesthesia and the sometimes coercive use of ECT led to its portrayal as inhumane in recorded media and literature. During early treatment, ECT often resulted in serious complications like bone fractures and severe memory loss. Thus, by 1950, anesthesia and muscle relaxants were introduced to make the procedure safer. However, modern ECT involves precise control of electrical currents, typically delivered via unilateral electrode placements to minimize cognitive side effects. Looking at the theoretical framework, studies in the late 20th century demonstrated that ECT is highly effective for treatment-resistant depression and certain cases of acute mania. Research in neurobiology has provided insights into how ECT may modulate neurotransmitter systems and neural connectivity, which explains its somewhat antidepressant-like effects it produces. ECT's reputation has gradually improved as clinicians highlight its benefits in cases where other treatments have failed. The American Psychiatric Association and the National Institute of Health and Care's Excellence now perceive ECT as a viable treatment for severe psychiatric disorders. Again, in practice, electroconvulsive therapy involves inducing a controlled seizure lasting 20 to 50 seconds administered under general anesthesia. Treatments are typically conducted 2 to 3 times per week over a course of 6 to 10 sessions. A case of this application was seen in a 45-year-old man with severe major depressive disorder, unresponsive to other functional treatments such as medication and psychotherapy, who underwent ECT. Through a careful, structured, and controlled treatment plan, he gradually experienced significant symptom relief, eventually returning to his regular lifestyle. In the context of psychopathology, ECT is often recommended for conditions that are not responding to pharmacological treatments. The DSM-5-TR includes ECT as a treatment option for major depressive disorder with psychotic features. Although ECT is accepted in regions with established protocols and informative patient education, it is viewed as a last resort in some cultures due to ethical concerns. This perception can limit its accessibility and usage in certain areas. Nevertheless, modern ECT adheres to strict ethical standards, emphasizing the importance of informed consent, particularly for vulnerable populations, to ensure patient rights and safety. Despite advancements, cognitive side effects such as short-term memory loss remain a notable drawback. Additionally, historical misuse of ECT has contributed to its negative public perception. Critics also debate whether truly informed consent can be obtained from severely ill patients, raising ethical concerns for its application in such cases. Looking at the future directions for ECT, technological advancements are paving the way for alternative treatments like magnetic seizure therapy, which uses magnetic fields instead of electrical currents and shows promise in reducing cognitive side effects. Additionally, advances in imaging techniques could help personalize ECT by identifying the optimal brain regions for stimulation. If these innovations lead to a safer and more ethical approach, ECT's utility may expand significantly in the future. These are the scholarly sources used for this infographic, and thank you for your time and attention during this presentation, and I hope you are a little bit more informed on electroconvulsive therapy.